one of the great things I always love about these meetings is as the new members come on, we hear sort of their origin stories. And I realized, what helps drive them, what's created their superpowers. And one of the reasons I'm here with this topic today is because I grew up with my mother, who ran a community health center in Trenton in the 80s. Trenton, New Jersey, as you can imagine, in the 1980s, was a place with lots of need. It grew to end up being about 5 clinics across central New Jersey serving low income, focus on women and children, sort of folks who were otherwise left out of the medical system. And that was my experience. So I wasn't Phil, I wasn't a manager, I wasn't able to be in there, actually interacting with clients. But that always left me with this deep impression of you had these doctors and nurses who could be doing other things, but had chosen to really dedicate themselves with the passion to that social impact, as well as that model always seemed precarious. It was very dependent on funding in a given period of time. And so I've always sort of had the back of my mind, what are some other ways that we might be able to do that? And so in other places and within the veterinary industry, we're starting to see some of those models. And so that's what I'm hoping to give us a little preview of today. And then to sort of start a discussion. I mean, this is something I'd really just, there are other people doing this. There are people in this room who are doing this. Let's sort of continue to build on these themes of diversity and inclusion. And this can continue to be sort of part of that discussion. So we're going to talk a little bit about sort of what are some alternative structures for ownership and approaches, in particular for a veterinary clinic. So obviously shelter medicine is a huge component of this. So not to discount that in any way, this is just sort of shifting the concept from sheltering and homing pets to serving people particularly in sort of underserved markets. So what are we talking about? These are some of the things I've sort of heard and observed. I'm admittedly quite new to the industry. I've only been working with Trey for a couple of years. But I've regularly heard, right, veterinarians are not in this for the money. This isn't a job, this is a calling to a profession. This is a place where there can be conflict between the sort of concept of doing good and making money, right? Or you can have a conflict between serving a client, and we hear lots about the tension of cost and being underserved and how we have all these different things that tend to hinge around cost. So could we change that conversation with a different approach? Time feels right in the fact that this is an industry admittedly in transition, right? We have a lot of new technology coming in, we have new entrants, we have new ownership forms, as well as we have new services, right? 30 years ago, you didn't have enormous standalone emergency hospitals. You didn't have deep specialists. So is this a time as we've broadened that field and broadened the models that we can be thinking about it in other ways? And then obviously in January, you spent a bunch of time as this organization talking about these concepts, right? So how do we as a group continue to build on this and help sort of create some community and find people a home for this? So just briefly today, my main discussion is to sort of my main goal today is to spark a discussion. We're gonna provide some samples of what other people are doing in other industries, what we've sort of have anecdotally come into working with our clients, and then we're going to sort of put that together with some samples about what this looks like in the field. So right, you could cut this slide 1,000 different ways. How would you describe how veterinary services are delivered? But there's a wide range, right? So we have sort of what we might describe as the typical practice. A couple of doctors, one doctor, delivered primarily for companion animals. We obviously have lots of other things for other types of animals. You now have large hospitals, specialties. You have emerging other themes, right? Mobile, remote, telemedicine. Models that are sort of on the fringes, either in delivery in existing hospitals, or maybe models that are continuing to be developed. I mean, we occasionally still have clients coming to us sort of pitching new things, maybe broadly in kind of telemedicine or mobile, but it is a new take on how you find customers, how you serve customers, and sort of what your relationship in order to provide healthcare to animals is. So what are some of the things we can talk about that might think about this differently? So a big one would be a nonprofit practice, right? So we can talk about what that might look like. I want to talk a bit about social enterprise. Social enterprise is a really difficult concept to define. I'll sort of do my best by leaning on others who know it better. Sort of broadly speaking, the idea is it's self-sustaining with profit not as the central metric of what you're measuring. You're measuring something else, but you've created a self-sustaining model, so you're not relying solely on donations. You have a whole world of hybrids and other things, And we've talked about, I know Jeff had forwarded this soon before the meeting, right? Other ownership concepts, co-op, worker-owned. Could you have collectives? Could you build on partnerships that already exist in the industry? And what might that look like? So what I always love about nonprofits, we call it nonprofit, not-for-profit, right? It's a tax status at the end of the day. It's not a business model. It doesn't mean you don't make money. It means that the IRS grants you a waiver from paying taxes for a societal good, effectively, right? Lots of criteria within that. You can split that apart. And as an organization, you can't return the profits to shareholders. You can pay people salaries. Museums and educational institutions pay themselves salaries in the millions of dollars, right? So it's not that you're limited to sort of poverty level things. It's that you aren't then giving profits and returning profits to an owner. So effectively, in some ways, everyone would be an associate, right? Everyone gets a salary. Any excess is reinvested in the business the next year. It doesn't get divided up among that. Some other things you need to think about. It's really driven by the IRS, right? So this is a tax status. You form an entity. I won't get all legal on the process of where this goes. Main criteria, IRS, there are state requirements. Another piece of this is because it's focused on societal good, you need outside advisors in almost every state, right? You need a board of directors. You don't get to just have one owner sort of making those decisions. It does require some outside input, which is good. It can also be logistically challenging to get set up, obviously. So let's talk a bit about what a social enterprise is. So we can read this. Effectively, as I said, a social enterprise is focused on what is sort of a societal good that we can deliver as the core mission of the organization, but make it self-sustaining. Can you use that as a blended business? You can use that to you're allowed to sort of earn revenue. Maybe your business is profit-making and is not a nonprofit, but your product, it benefits the environment, right? You may not have heard about, there was a shoe I saw recently. Adidas has made a shoe completely or mostly from ocean plastic garbage, right? So garbage taken out of the ocean, reprocessed into a shoe. If that was your business, arguably that's a social enterprise, right? You're taking waste and you're turning it into something else that has a societal benefit. So what are other people doing in other organizations? Has anyone known Homeboy, Tom's, the shoe company, Donors Choose? So these may be things you're familiar with. Homeboy's a local institution in Los Angeles, started by a Jesuit priest. It's an organization whose primary purpose is to help people coming out of prison re-enter society, primarily a focus on ex-gang members. What has it morphed into? It's a full-service bakery. It has restaurants. It has, you'll see it in the LA airport and certain terminals. It has cafes. Who are those staffed by? Ex-offenders. So it is a business. It earns money. But the entire purpose is to sustain itself, provide on-the-job training, provide all kinds of things, right? Healthcare, childcare, other things. Tom's, it's a shoe, sort of nominally a shoe company, right? A type of shoe. The original model being you bought a pair of shoes from them, and they gave a pair of shoes to a child in need in South America. And it was a type of shoe that the founder had found in South America that was common. The sort of buy one, give one, that model is branched out into other things. Tom's just a for-profit company. And so it sort of has used that as a brand halo. They're arguably more expensive than a comparative shoe. Huge business at this point. Donors Choose is interesting. It's a platform in education. Teachers can post basically needs and can be funded. So if you're familiar with crowdfunding, this is specific to teachers. They've done some really interesting things in partnerships. So someone like Gap, you got a coupon, or you could give a coupon based on a purchase for this. Right? So as we were talking about yesterday from Stacy, sort of reward programs, well, it was a reward to a third party, which was a nonprofit, right? So you got sort of funding for that. And then, this happens in other industries, right? I mean, veterinary is not the only place where this is a challenge. Legal, huge issue, right? Lots of people underserved in terms of getting their legal needs met. Lawyers seem incredibly expensive to everyone all the time. Well, so there's some hybrids, right? Nonprofit law firms, sliding scale, kind of pay what you can based on the situation, and community health across the board. Dentistry in particular, right? People have set up practices in underserved areas with the goal of providing high quality dental medicine or healthcare. to people who otherwise couldn't afford it at much lower prices. And so we heard in January, particularly, I guess it was the PetSmart charities, right? We saw the demand curves, and we saw the fact that there were people sort of left out of what we'd call traditional markets or traditional models. And so there seemed to be an opportunity of, well, if you change the delivery potentially, could you reach more of those people? So what I'm going to do here is go quickly through a couple of potential models of what this could look like for discussion. Obviously, these are not exhaustive. Some of these are based, so this is the concept of sort of a community veterinary hospital, probably a nonprofit. So the acronyms are effectively model, revenue sources, strengths, and weaknesses. I mean, you can cut this a million different ways, and you can do this in a lot more depth. The concept here is that your model is much like a normal hospital, right? You know, you have one doctor, two doctors. You know, we have clients who do this already. They just call it not collecting their accounts receivable. You know, you talk to them and you go, what is this? And he goes, well, I traded, you know, a house for that. Someone came and did construction, and that's why this is a huge bill here. You know, they paid off their surgery in that way. So it already happens, right? I mean, this happens because people have big hearts and, you know, already. So what if that's the focus of your business, is providing more services to more people rather than sort of using profit as your only metric? Well, so how might you fund this? Patients, right? You know, I live in an area, especially last year in Los Angeles, incredibly diverse in terms of socioeconomic and sort of everything else. Well, that's a place where you have people with a lot of money who pay premium prices for veterinary care, and people who have pets who don't get any, right? Or might have to go to a completely different market, even though you're all within a mile of each other in a large major city. Additionally, you can always rely on grants, right? I mean, there's plenty of other funding in the world. There's plenty of funding. You know, every time I go to Petco, I pay the extra $2, you know, to fund a pet in need. There's lots of those sources in the world as well, so that you can get grants, but you could also be charging sort of a price for this. You know, some of the strengths are, to some extent, it's familiar, right? This is a model that we know. This is a model that vets have made work. And you know, so this also is a model that then increases access. Challenges, of course, is this is complex. I mean, as we all know, running a small animal hospital, and as many practices are no-low or arguably have challenges with cash flow, it's not easy to do. So adding on the complexity of tax status and outside involvement and finding additional funding. So it's not a panacea, and it's definitely not easy in that way. And then you have the funding issue, right? If your pitch is we don't turn anyone away, well, what if you don't have enough self-sustaining patients and you're sort of still spending that time chasing grants? Well, okay, you know, it feels like that's fine as long as you sort of know it going in. So what else could this look like? So this could look like a buy one, give one model, right? You have places, and we've had a couple of clients who've asked, and there are in veterinary effectively captive foundations, right? So customers come in, they want to give back, they like their veterinarian, maybe they're in an affluent area, and they say, how do I do that? And some hospitals have started having related foundations, or they say, give to this organization. You don't have to endorse it, but you could add that on. You could take that further so that, you know, you choose to pay a higher price, you choose to pay the premium for a set of canvas shoes. I don't know what the veterinary equivalent of overpriced canvas shoes would be, but you choose to pay a higher price to subsidize the delivery of that service at a lower cost or for free to someone else, right? You pay more for your spay-neuter so someone else can get a free or low-cost spay-neuter. So again, you know, sort of how would we fund this? You know, again, patients, right? So the idea here, and this could be in one hospital, this could be in two, this could be diversified, right? So you could have a really high-performing hospital, and you could take that, and that could fund a hospital in a different location. It doesn't have to be one hospital doing all of these things, one veterinarian doing all of these things. You could also have the sort of captive nonprofit. This could be your organization doing that itself. You know, maybe you have that skill set sort of, you know, and you can build on it and leverage it with others. So some of the strengths here is you can get a branding halo, right? I mean, that's what these businesses do in a purely retail setting, and there are some even in the pet space, and I, of course, couldn't find them when I was putting together this presentation, but have seen, you know, you buy toys, and they send toys to shelter pets, right? There is a buy one, give one model as well in that regard. And so you could see how that would create a branding halo to your hospital of this is the hospital that's also doing good for other people as well as providing me great care. Again, you sort of have the complexity and the location challenge is the idea of do you do this in one place? Do you do this in more than one? How do you find those partnerships? And as Peter always talks about, right, there's whole areas, particularly Metro Los Angeles, none whatsoever. Well, you don't easily create a new veterinary hospital where one has never existed. So how do you maybe link those two together, and what does that look like? So another concept here, and this again is happening as we use our spaces differently. I was just reading a strange article that restaurants in New York and San Francisco are being closed during the day and they're turning into co-working spaces because it was more profitable for them to not be a restaurant for lunch. So as people start rethinking space, okay, you're closed on a Sunday. Could you let a differently branded organization come in and operate for that? And you could tell clients, if you're not comfortable paying whatever it is, come back. This organization's here the first Friday of every month. You see this already with mobile, right? You see this already. Petco, PetSmart have low-cost things. Well, could you take that a little bit further? So again, how would this pay for itself? Again, patient cost, right? One subsidizing the other, charging on a sliding scale, and grants. Obviously, here, some of this is startup cost, right? I mean, if you're building a mobile clinic, that's not an inexpensive thing, taking it someplace, having the equipment. You have some of the brands, and then sort of, again, the complexity here is, well, how do you make multiple services in one hospital with different goals work, right? What does that look like? That's not an easy setup necessarily. So variations on the theme, I'm not going to spend a ton of time on this, but would be happy to talk about it, right? I mean, what might this look like? So community, and we have a client who's done this, had a hospital. You could convert it, right? It doesn't have to be a for-profit to a for-profit. We had a client in a fortunate position, outgrew a facility, built a huge new one, completely different business model. What's he going to do in the older hospital that holds 1 or 2 doctors? A community-focused veterinary clinic. He's in a fortunate position, doesn't really need that money, but if it's self-sustaining, great. Equipment isn't worth a ton to him to move somewhere else. It's already there. What about corporate sponsorship, right? VCA has a lot of doctors. What if they opened one and rotated their own staff through it? Great staff retention concept, right? Love the training. To some extent, this is what law firms do. They subsidize their attorneys going other places, delivering services, and coming back. It's a huge selling point. And then we also have already seen, and we talked a little bit in January, you have folks who are doing intentionally low margin, high volume. You could do that in a similar model. So some of these things you may have also heard. A B Corp, has anyone heard about a B Corp? So a B Corp it's not a status, unfortunately. It's basically a corporation that says we're committed to more than returning money to our shareholders. We have other goals involved. It's a little bit of a sort of legal thing. Arguably, you have to return as much money to your shareholders as possible. This allows you to say our corporation's intentionally not doing that. Someone like Patagonia, the retailer, if not a B Corp, I believe it is a B Corp, but sort of that model. Employee-owned and other things. This is probably a little bit more challenging in the veterinary industry because many staff are lower paid, right? I mean, they don't have additional cash to contribute. But you see this in some companies where the retirement plan is the owner of the company, and a variety of sort of other models in that regard. So of course there's challenges, right? So let's talk about briefly, and we can highlight a ton of these. So funding. There is a world of nonprofit funding, right? There are lenders, there are requirements of major banks that they have to lend in lower income communities. They have to make financing available. There's a lot of sort of conceptual change in the financing of mission-oriented organizations. We also have the great fortune of seeing newly, often very wealthy veterinarians. And what are they, when I ask them what they're doing, I'm looking to do it to carve out of their non-competition agreement after the closing. More often than not, it's volunteer, open an animal shelter, build an animal shelter, right? So could you also have sort of leverage this newly found committed wealth, and could that subsidize some of these as well? This is an amorphous concept, right? So I was trying to figure out what to say here, sort of selling the idea, right? How do you find like-minded people, like-minded resources, bring them together, give them some tools, right? We all know how disparate this is, 25,000 veterinary clinics. Well, how do you connect someone who's coming out of veterinary school who wants to do this, right? So some of this is, could we leverage some of these as a toolkit to do that? It's obviously going to be a niche situation, right? I mean, this isn't a panacea. This isn't going to reorient the entire industry, but it can exist on the side. As I talked about briefly before, nonprofit status is a challenge. I mean, it's a process. It doesn't happen in a week. It takes months. You have to be good at it, but people are, and so that's accomplishing. I think the other thing is failures, right? This is not necessarily a new idea, but if you're trying to create a new movement, how do you get comfortable that something works or doesn't? And how do you as a young organization pivot when things work or they don't? And how do you not just get bogged down and, okay, we tried, it failed, let's pack it up and go do something else? And then, of course, all of this is on a spectrum. So this isn't a neat box. Social enterprise is almost impossible to define. So how do you even put this in the spectrum of veterinary services? And sometimes, to the idea of selling it, it's a little harder for people to wrap their heads around when it's new and when it's on a spectrum.